double the amount from 10 years ago. And opioids are involved in roughly 90% of these fatalities. And then fentanyl, which is a potent synthetic opioid, it is the leading cause of death among 18 to 49-year-olds. And although most overdose deaths are related to adults, teen and tween rates are on the rise as well. So as we can see in this graph, synthetic opioids have become the leading cause of death in recent years. And although data has shown that teens are taking less substances lately, fentanyl poisoning and overdose remain really high. You may be familiar with this picture on top, and this is what a lethal dose of fentanyl looks like. Because it is 15 times stronger than heroin and 100 times stronger than morphine, it really does not take a lot. But 90% of fatal overdoses in teens do involve fentanyl, and out of those 90%, only 35% had a documented history of opioid use, which really gets into a kid who has never taken any sort of opioid before may think they're buying an Adderall or may think they're buying a different drug, which contains fentanyl and then leads to that fentanyl poisoning. And this is, you know, through counterfeit pills, and then the rise of social media has really created more ease of access to obtaining those fentanyl pills. And as somebody who's grown up like with the rise of social media, I've really seen drugs marketed through platforms like Snapchat that really promote like in the moment, temporary content, like harder to trace, things like that. So next slide, please. And then this is really a problem here in Texas too, because as overdose fatalities have increased by more than 75% from 2018 to 2022, Texas is currently ranked second in the nation for cases of opioid use disorder, with almost 500,000 people affected. And an average of 5 Texans have died each day from fentanyl poisoning in 2022. And the CDC estimates that unintentional overdoses and opioid use disorder has cost the state over $58 billion. And much of this cost reflecting the immeasurable value of lives lost, but also the cost of mental health professionals in Texas too. And this is a problem really happening in our backyard here in Hays County, Texas. Hays County ranks among the top 10 counties for fentanyl poisoning deaths with a rate of 8 per 100,000 students. And since January of 2022, Hays County has seen 70 fentanyl overdoses with a 13% rise in juvenile overdose cases and deaths. And in 2022, 40% of fentanyl overdoses recorded by the Hays County Sheriff's Office involved minors. But you may be, driving down I-35 or driving down the highway and seeing billboards warning about the dangers of fentanyl, or seeing more programs distributing Narcan. But this is a real growing concern. And in Hays County schools alone, 7 minors have passed away since 2022, and they've repeatedly had to administer naloxone or Narcan, which these numbers really demonstrate the need for action in the community for us to get through this crisis.
Thank you, Taylor. So I appreciate you setting us up for Texas as well as Hays County. And one thing that we really want to get across in this presentation is that this issue, this problem, the prevention that needs to happen in our backyard with our schools and other outreach capacity. So in 2023, Tucker's Law was passed in the state of Texas, based on advocacy amongst many groups who had lost either their children or friends to a fentanyl poisoning or fentanyl overdose. So Tucker's Law was passed, and it mandates schools, public schools, to implement annual training, education regarding substance use, fentanyl, mental health, and suicide. With that being said, with that mandate for schools, and also knowing that schools have a lot on their plate of different requirements that they have to meet, it seems like a natural fit to assist schools in our community in fulfilling that mandate of Tucker's Law. So that is where applying for funding through SAMHSA happened last February. And we proposed the FESTA program, which again stands for Fentanyl Education, Support, Training, and Awareness. We were funded $1.8 million through SAMHSA for 5 years, with the goal of helping reduce the onset and progression of substance misuse as it relates to opioids, with that specific focus on fentanyl poisoning and overdoses within our community. So this is a program that we began in September 2024, and we have 5 years of really hoping to do some good work throughout Hays County. So who are we targeting? Well, anybody, any adult, any minor is eligible in Hays County to participate in any of our activities. We do have a specific focus on students, 6th through 12th graders, parents and caretakers, as well as teachers and faculty. As I mentioned before, it really does take a village, and prevention needs to be holistic, comprehensive. And we think if we're able to get in with all of those different angles, we will be able to hopefully reach our goal of reducing the likelihood of additional fentanyl overdoses or poisonings. So how are we implementing the FESTA program? We have multiple different kind of arms that we are utilizing. So the first one is educational curriculum. So we are in the works of creating PowerPoint presentations, interactive activities for 6th through 12th graders, with implementation happening in April and May of this year for Wimberley ISD, and then Dripping Springs in October. This educational curriculum will be interactive. It will get our students thinking, and it will give them the understanding of what fentanyl is. We really want them to walk away with fentanyl can be in anything we buy off the street, right? It can be in cannabis, it could be in a vape pen, it could be in a Xanax, an Adderall, anything. Statistics show that 42% of pills that are purchased on the street have a lethal dose of fentanyl in it. And that lethal dose is that little amount that was shown on that pencil on earlier slides, 2 milligrams. So not a lot. Not a lot can be lethal. And we really are trying to get that across with students that they don't know what they are buying. And we're actually doing that through some metaphors and some visuals so students can really stick with that. We're also doing educational training for teachers and faculty with the idea that they will be equipped of signs when there might be an issue, as well as Narcan training so that they have that available to them if a student does experience an overdose at an after-school event or even in the bathroom at school. And then also educational outreach and trainings for parents and caregivers so that they are also equipped with that information and they feel confident in addressing and talking about this with students. We really think that reducing the stigma, the taboo-ness of this topic can help us reach our goal. Train the Trainer program. This is a 5-year funded grant where we will be going into classrooms and implementing that curriculum. But at the end of the 5 years, we don't just want to leave and say, good luck. We want to equip the teachers with the information on how to implement those presentations so it can continue beyond our funding. We'll be doing outreach activities during Fentanyl Poisoning Awareness Week, which happens in October, very similar to Red Ribbon Week. We will be hiring a youth licensed chemical dependency counselor, or an LCDC, that will be part-time for both of our school districts and will help some of those high-risk students or students who have experienced some of these behaviors so that we can intervene. And then we also have a community advisory board. which we have 4 partners on our community advisory board, and we meet monthly. They share with me trends that are happening in the community. They help put on outreach events, and we really are building this collaborative project so that this information and our mission can continue beyond this 5 years. So who is part of our community advisory board? We have 4 partners. We have the Hays County Sheriff's Office, specifically Anthony Hippolito serves on our board. We have Hill Country Mental Health and Developmental Disabilities Center, MHDD. Texas ICON, or Integrated Community Opioid Network. And then Senecor. And this is a great segue for me to turn it over to Carla to share more about what great things Senecor does in the community.
Thank you, Kelly. Appreciate that. So yes, just again, everybody, I'm Carla Merritt, and I am our Prevention and Youth Recovery Community Director. Many of you probably know Senecor as really about our adult treatment programs, but we are much more than that. And so I want to spend the next few minutes just going over our youth programs and what we do and what that looks like for our continuum of care. And so next slide, please, Kelly. So we actually have several programs here in San Marcos. So the biggest is our prevention program, and the one that I alluded to earlier. So that program, again, has been in this area in San Marcos, in Hays County, for over 30 years. It was run by a previous smaller nonprofit, and then it transitioned to Senecor about 9 years ago. So what prevention does is exactly that, promoting health and wellness across the lifespan. So that could be from a 6-year-old to a 16-year-old to a 60-year-old. So really is across the lifespan, that good health and wellness. But we also then focus in on the alcohol, tobacco, and other drug components. So like Kelly was saying, where our youth from like 6th grade on up, that middle school and high school age level, we do a lot of educational presentations. For example, regarding the fentanyl, we did go to San Marcos High School in the fall, in October, and we presented to all the 9th graders. We will do that same presentation with some adaptions to all of the senior class and right before spring break. So timing is sometimes a key component in that. So our presentations cover, again, that age gamut of youth. It can be 3rd graders. It can be, like I said, 9th graders and adults. So we don't want to forget about our adults in our community. Again, the parents and other key partners. So our prevention really covers the gamut. We do have a curriculum that our prevention specialists do go out and go into the classrooms. And that is a weekly curriculum that they go in semester by semester. So again, promoting that health and wellness and talking about decision making and all the things that our youth need to know to be healthy, both mentally and physically. So there's that. And then our project AIM, although it's more of an intervention for adults, I did want to mention that program because it is here in San Marcos, and that is a SAMHSA based program. And so that is an important component for the adults and parents in our community. And then our youth recovery community, whereas we'd like to say that prevention is on the front end of our continuum of care, our youth recovery community is actually kind of on the back end of that community care. So that is a program funded by the state, and it's recovery support for youth and their families, either youth that are in recovery already or they are thinking about being in recovery, right? They're struggling with that piece, and our peer recovery leaders can help with that support they need. Individual mentoring sessions, we have groups, and also we do fun and sober events. just developmentally where youth are, they like to congregate together, right? They want to be together. And so we make sure that we have those fun and sober social events for them. So next slide, please, Kelly. So who are our partnerships? First of all, I don't have this on there. It's just kind of a given. But going back to the FESTA program and our connection with Kelly and that initiative, because we can't do it alone. And so it really is a a partnership. And so when Kelly contacted me and said, "Hey, I'm going to write this grant. Do you think you would want to be one of our partners?" I said, "Absolutely," because it takes all of us to do this. So other partnerships, of course, our school districts, our local government, work real closely with our city, our county, again, Texas State, and then other local organizations that we partner with in San Marcos, Hays County, and our other counties that we serve. And then faith-based. So we do have a couple of faith-based churches and people that we have partnered with as well. So next slide, please. So where are we located? So getting it really broad here, but other than San Marcos and this area, we also have a prevention program in Amarillo. We expanded to Amarillo 5 years ago, became very successful over there. And then we rewrote for our grants last year and decided to try to expand again. And so we expanded into the Conroe area. So that program had just started this year in September. And so it is up and going, and we're very excited about that expansion and reaching that area in the Conroe area. So, and just the San Marcos, Amarillo, and Conroe each have a minimum of 4 counties that our prevention specialists serve. So sometimes we're stretched a little bit thin. So again, it's very important that that we're partnering in these different areas with different organizations. So, and then our project aim that I spoke about, San Marcos, Hays, and Caldwell counties. So they serve those multiple counties. And then our YRC, that location is actually in Buda, but they also serve San Marcos as well, and a little bit further counties up in Travis County. But we also have a youth recovery community in Amarillo and Tyler as well. So you can see our youth programs, where we're located, we're really spread out, but that's a good thing in the state of Texas for us. So I do want to bring attention to one more youth program, and I did not list it on here, but Synacor does have a residential treatment youth program. So just want to mention that, and that is called Odyssey House. It is located in the Houston area. So I don't want to fail to mention that, because sometimes what we'll find when we have a parent on our doorstep is they're looking for something that's a higher level of care than we can do here in the San Marcos area. So we will definitely help them to navigate that piece. So and I think that's all my slides, Kelly.
Thank you, Carla. So we have put together a flyer that we want to share with you all regarding a little bit more about the FESTA program, who we will serve, the team, and then we also have a website and an email address. If you think that any organizations or any groups throughout Hays County could use any support, training, awareness, education, please reach out to us. Like I mentioned before, we are connected with and collaborating specifically with Wimberley ISD and Dripping Springs ISD, with hopes to expand that with other school districts in Hays County. So we appreciate any additional collaborations, networking that can be done, because we understand that there are various groups, entities that are doing similar work, and we want to be collaborative rather than competitive in sharing this space in our community. Because again, like Carla mentioned, it really does take a lot of work, a lot of effort. It takes a village, and we can always resource share and network that way. So with that being said, we do have an email address. We do have a website that you all can check out. And since we do have some funding, this is considered an outreach training regarding this topic. So if you are interested in completing a survey, giving us feedback about this topic and what you would like to see in the community, there is a QR code to complete an IRB approved anonymous confidential survey. And if you're interested, you can also do an interview. Again, there are Amazon gift cards associated with completion. We would appreciate any feedback that you all have for us, and what types of outreach or training or curriculum would be helpful regarding the topic of fentanyl, because doing work in the community, I emphasize that collaborative nature, and also knowing that the community knows what they need. The community knows best, and I would like to facilitate and understand that so that we can serve those needs and reach what they're looking for. So I will go ahead and put it back on this flyer, because that is all the information that we have, and we're open to questions and anything that we can provide you all.